Good morning. I am thrilled to present Srini Kota to you. He was my first PhD hire for the division. I'm the Chief of Neonatology Services, and my lab focuses on translational to clinical computational methodologies on these diseases that affect babies like asphyxia. And this condition, when I started my lab and my training and my career, was non-modifiable. We couldn't do anything. And now we have therapies if we intervene early. And at the basis of it, and we could really change outcomes, decrease death by 50%, reduce disability remarkably. At the base of it is interdisciplinary team science. And that's why and Dr. Srini embodies that team science. He has been here for 2 years with us, already 10 publications, stellar researcher, stellar educator. He obtained his PhD at the University of Southern Illinois in computational and electrical engineering. He moved from Signal to Fetal Institute at Washington, D.C. University, and our path crossed as part of this multidisciplinary team science, and I'm so glad to introduce him to you today. Srini?
Good morning. Thank you, Lena, for that kind introduction. Lena mentioned I'm an electrical engineer by training. I get this question often, what an electrical engineer does in neonatology. Motivated by my 2 siblings who experienced a pediatric stroke and polio, my doctoral research focused on developing machine learning and signal processing applications in human-machine interface applications that can make a difference in people's lives. My unconventional career path started with the postdoc in psychology. I worked across multiple disciplines, working on brain signals. I spent a couple of years in industry. And then my passion for neonatal research, as well as a team science, led me back to UT Southwestern. Like Dr. Konove mentioned, that I couldn't stay away from UT Southwestern for too long, to work with Dr. Elena Shalak. Dr. Elena Shalak is an international expert in perinatal asphyxia. As she mentioned, for several years, it was thought that this condition is untreatable. And then she made breakthroughs in this domain. HI is a type of a brain damage that occurs in newborns, major cause of morbidity and mortality in newborns worldwide, with an estimated 1 to 2 million cases annually. This perinatal asphyxia is like a mountain. We may not be able to move a mountain, but at least we can move in the needle in the right direction. Blood flow helps baby's brain to develop. Whenever placental abruption or umbilical cord accidents happen, so the blood flow slows down, that leads to brain injury. Abnormal outcomes may include epilepsy, cerebral palsy, and neurodevelopmental delays. Depends on the severity of injury. The spectrum of injury is complex. The severity is assessed using 6-category neurological exam and classified as a mild, moderate, or severe. For several years, mild and normal were considered as a one group. More than 50% of these babies with mild injury experience neurodevelopmental delays. And the neurological exam can be subjective, may change frequently due to the evolving nature of injury. So therefore, and may not be possible to repeat multiple times at the bedside. Therefore, there is a strong need for continuous brain health monitoring. Our lab adopted continuous measures for brain function like EEG and NIRS for brain perfusion. The combined approach provides a comprehensive picture of the brain health, such as neurovascular coupling. Our lab is pioneered in the neurovascular coupling. The neurovascular unit plays critical role in delivering oxygen and nutrients to the brain. Dr. Shalak adopted a weather forecasting tool called wavelet transform coherence analysis, used to quantify neurovascular coupling between oscillations of amplitude integrated EEG as well as the cerebral tissue oxygen saturation. When neuronal activity and cerebral tissue oxygenation is synchronized, we see red areas in this wavelet coherence transform. In this example, we don't see much difference in EEG and NIRS across two different babies and also time frequency spectrums. But whenever we calculate wavelet coherence, we see large red areas in this baby, which is a predictor of normal brain. Whereas in this spectrum, we see only very few red spots, which is predictor of abnormal brain. In this case, baby had abnormal basal ganglia injuries. Though this method provides a comprehensive view of brain health, but it requires at least 20 hours of data. With Dr. Shalak's current R01, we are currently developing a dynamic neurovascular coupling with a shorter duration of signals. My research focuses mainly on developing biomarkers with the EEG with a shorter time duration as well as for the rapid assessment. We recruited babies from Parkland Hospital, inclusion and exclusion criteria similar to hypothermia trials. Newborns with a moderate and severe HIE received therapeutic hypothermia for 72 hours, followed by rewarming and normothermia. Newborns with a mild HIE who were not cooled as a standard care. We collect MRI before the baby's discharge. We used the CNS monitor to collect EEG and NIRS data. For EEG analysis, we mainly focus on central parietal region leads because they reflect basal ganglia and watershed region injuries in these newborns. So here is an example of the EEG for first 5 seconds for one of the babies from each group. The brain function is represented on EEG by oscillations. Oscillations can be quantified using power spectral density, which provides a power value at every frequency, which is on x-axis. In this example, the mild babies have higher power spectral density throughout all the frequencies compared to the severe, which represents the severe babies have the signal suppression. Then we calculated the delta and total power values for each newborn and compared across the groups. The mild injury group had significantly higher delta power and then total power compared to the moderate, whereas the mild moderate group, who were initially classified as a mild, and the latter progressed in the first day of life. This is the reason we highlight the continuous monitoring is essential. And we observed that 1 unit increase in delta power was associated with significantly lower the odds of encephalopathy severity. In this study, we found that the delta and total power are sensitive real-time biomarkers to monitor the dynamic evolution of encephalopathy severity in the first day of life. Currently, we are working on exploring this whether individual biomarkers or combined biomarkers can predict 2-year neurodevelopmental outcome. Here, we are looking at the cognitive outcome at 2 years of age. Cognitive score less than 85 considered as an abnormal outcome. We observed that sensitivity, positive predictive value, and negative predictive value are marginally higher for the combined biomarkers, whereas here, the cutoff values from AUC analysis can be used at the bedside for real-time analysis for timely interventions. However, these biomarkers were calculated offline, but our goal is to take the technology to the bedside for real-time applications. We are actively collaborating with other international engineers from Finland who developed this cloud-based tool to calculate brain state of newborn, which is a quantitative metric of EEG background. The tool uses a convolutional neural network. The model used over 2,000 hours of EEG data from 40 newborns. It is an example of BSN value that ranges from 0 to 100. 100 being normal brain activity, close to 0 means the brain activity is suppressed. It is an example of 4 different groups, normal and mild, moderate and severe. Shaded region here indicates the classifier's confidence on the BSN value at that particular time instance. The dashed line here indicates the average BSN value over 1 hour of recording. Sorry. It can be clearly observed here, the BSN value change is different across 4 different groups. And we wanted to study whether BSN value can be used to predict 2-year outcome. The abnormal outcome is defined as a death or disability defined by cognition, language, or motor score less than 85. We analyzed the BSN values between normal and abnormal outcomes as early as 6 hours of life to 60 hours of life. We found that BSN value for normal baby are significantly higher throughout the time period. Infants with a higher BSN values had a lower odds of neurodevelopmental impairment. This is a promising real-time bedside tool for monitoring evolving encephalopathy as well as to predict neurodevelopmental outcome. At least 20% of the babies experience seizures in early hours of life. And I'm currently working on a KO1 grant application to develop a model to predict seizures. Here is an example of adult seizures and earthquakes, which look very similar in terms of time series signal as well as power spectral density. On the right, we have a predictive probability of seizures, whereas earthquakes may be predicted earlier, 10 days early, but seizures can be predicted only 30 minutes in advance. The presence of seizures can be biomarkers for abnormal outcomes, so that's why we are working on developing forecast model for seizures. Our overall research goal is to develop AI-based multi-model biomarker panel that includes maternal and neonatal characteristics, neurological exam, inflammation levels, heart rate variability, EEG biomarkers like spectral power, BSN, neurovascular coupling, and autoregulation to develop a model to assess the severity of the HIE in real time at the bedside for timely interventions, as well as to predict short-term outcome like an injury on an MRI within 5 to 7 days of life, and also 2-year neurodevelopmental outcome so that we can develop early intervention to make a difference in these babies. I would like to thank Dr. Shalak for her guidance and support, and also multidisciplinary team of postdocs, biostatistician, research nurses, mentees, and bioengineers. Last but not least, I would like to thank our research participants. Thank you.